I'm Dr. Abhishek Chatterjee. I'm a board-certified plastic surgeon, and I'm also a breast surgical oncologist, where I take care of breast cancer patients and do the full gamut of reconstructive plastic surgery. My journey with closed-incision negative pressure therapy has been a long journey, and I was a few years into practice when I first heard about Prevena Therapy. I was first introduced to it by a representative of 3M. And he not only came in with the knowledge of Prevena Therapy, but he also showed up to my first few cases, which, by the way, were quite challenging cases, because I wanted to challenge this type of technology. And lo and behold, it worked. So I started to use it more and more. And anecdotally, I started to see that my postoperative complication rates with Prevena Therapy started to decrease. And so when you start to see that, you start to become a believer even more so. The first category you look at is preoperative risk factors that patients might have. So you always worry about the smokers. Other preoperative risk factors that the patients might come with include diabetes, especially the uncontrolled diabetic, patients who are immunosuppressed on medications for whichever reasons, such as prednisone, patients who have a BMI that is high, and then patients who've had a history of past surgery in the area that you have to reoperate. Another risk factor would be radiation. Especially in breast cancer, patients tend to get radiation in breast conservation surgery. The last group of patients are patients who are having a particular type of surgery. So any type of surgery that has a large incision that subsequently undergoes severe undermining, so you have to elevate skin flaps, dissect away or through vessels. And an example of that is a mastectomy. There was a patient who had breast conservation therapy or a lumpectomy for breast cancer, and she had come back and the breast cancer had come back to the same breast, a recurrence of breast cancer. What you had was a breast that had surgery in the past and was subsequently radiated, so you had multiple risk factors that compromised the blood flow to the breast. Historically, these patients have a higher rate of postoperative complications. When I brought her back to clinic within a week after and removed the Prevena device, the incision was intact. There was no dehiscence or separation of the wound. And it looked as if the incision had healed over 3 weeks when in fact it was only approximately a few days after surgery. It was clearly intact. The scar looked more mature than I would expect typically within a few days. So all that was very reassuring. And the patient ended up doing great. Both the patient benefits from Prevena Therapy, but also the surgeon does as well.